Next, we're going to demonstrate Restylane in the lips and Juvéderm Ultra in the earlobes. Both Restylane and Juvéderm are hyaluronic acids. They're natural sugars. They're polysaccharides. Your connective tissue is made of hyaluronic acid, so you can't be allergic to it. There's no animal or human protein in it. They're just naturally derived sugars. They're very, very safe. Again, Juvéderm and Restylane are the only dermal fillers. They're actually reversible with hyaluronidase, and they're really great fillers for the tear troughs and vertical lipstick bleed lines and volumizing the lips. A new area to this industry we've been doing for the last few years is actually earlobes. Hyaluronic acid is great for the earlobes. Even Radiesse can be utilized in the earlobes. But as we age, just like we have facial volume loss, our earlobes also flatten out and lose volume. And nowadays with the earrings, sometimes the weight of the earrings, decades of wearing earrings, we actually have more sagging, elongated earlobes that we can actually correct with fillers and non-surgical. When we do the earlobes, we actually ice the area before we inject just to make it more comfortable. It's not a very vascular area, it's a very safe area to inject. And the key is when you're doing dermal fillers around the earlobes, avoid the earring hole because you don't want to lose any of that product. So you want to take a tiny little pinch, and this is again with Juvéderm, and you're going to thread a tiny little ribbon underneath the ear just to plump up and add volume to basically support the earlobe. And you can see that that earlobe is already starting to plump up. You can inject all the way around the earlobe. You can inject above the earlobe. You can actually inject along the earlobe. Little pinch right here, just to volumize. It's usually not a very painful injection, and you want to have them looking pretty plump. You want them to look, they're going to look a little swollen for a couple of days, and that's normal. With Juvéderm, the hyaluronic acid is very hydrophilic, so it pulls water into the product, so it naturally does swell. And just now we put 0.3 cc's of Juvéderm in the earlobe, and you can see the difference from this earlobe to this earlobe. That flatness and elongated earlobe is now plumped back up, and so she can actually utilize heavier earrings and have more support, and it's a more youthful earlobe. We're going to demonstrate Restylane in the lips. The lips are a very popular place. The safest filler, dermal filler for the lips is Restylane or Juvéderm. They're most popular. They're both hyaluronic acids. They're very safe. They're natural sugars. They are hydrophilic, so do explain to your patient they will swell because you pull a lot of water into the product. So most people look puffy for a couple days. They look a little bit ducky, but the filler is great for volumizing the lips, for improving vertical lipstick bleed lines, and overall improving the borders. That was sadly, as we age, our borders break down and we lose volume around the mouth. With the filler around the mouth, the lips are very sensitive. There's lots of nerve endings. Historically, before there was lidocaine in the products, we did do dental blocks. We stopped doing that many years ago. Now, as we start injecting, the lips start becoming numb, and we do ice the area, and we have used a BLT numbing cream prior to injection for about 15-20 minutes. And it's a small little pediatric needle. Little tiny pinch, going very, very slow, planing along that lip border into that vermilion, and then massaging that product to make a sharp border. You can actually start from the corner. Don't start all the way to the end for some people. You might want to start up a little bit and then just slowly lay that product along that vermilion border. And just feel there's no lumps or bumps, and the lips will swell. And then we're going to do the other side of the lip and do the lower part and the pillows. So you can do just the borders of the lips, or you can also add the wet meets dry. Open your mouth slightly. The wet meets dry is the center of the lips, and you can add like the pillows of the lips as well. And you want to pop up the cupid's bow, because as we age, the upper lip does elongate and the cupid's bow does flatten out, and it's a more youthful look to actually lift that cupid's bow. Another place that can be forgotten about is your philtrum columns. You can also put product along the philtrum columns that also will help lift the cupid's bow and make a more youthful mouth as well. Another place to not forget is the oral buttress, this oral commissure in the corners here. Sometimes if you take a little product and do this little V, this will also take the corner of the lip and lift it up, because for women, the corner of the mouth starts turning down, and you can actually put some product nicely in the corners of the mouth as well. Next, we're going to demonstrate doing tear troughs with dermal fillers. Historically, I've used both Juvéderm and Restylane, and today I'm going to use Restylane. Today in the literature, Restylane is a little less hydrophilic than Juvéderm, pulls a little less water to the product, so theoretically less swelling. The main key with the tear troughs, it's very a technique dependent area. Nowadays, we're getting a lot of orbital hollowness, a lot of people have dark circles because it's the gravity effect. And even for young individuals like my patient, Desiree, as the cheeks start migrating down the face, we start looking like we're tired, we're not getting a lot of sleep, and it's just this facial fat loss, and there's actually bone absorption that occurs around the eyes. So dermal fillers in the tear troughs are very, very popular. But again, it is technique dependent. That area you want to be very specific. You want to stick with the hyaluronic acids. We utilize a cannula because you want to actually go deep. You want to go under the orbicularis oculi muscle for safety. You want to understand where all your arteries are. Your angular artery is right here in this area. You want to be safe. You want to avoid vascular occlusions. You want to avoid Tyndall effect. That's the refraction of light that causes that bluish hue. And usually that's caused by too much product in one location or too superficial placement of that hyaluronic acid. So when you do the orbital hollowness, you want to address the tear trough where the tear would fall. You don't want to get too close. You never want to clog the lacrimal tear ducts. And nowadays we want to stay along the orbital rim, along this bony orbit. You don't want to go above that area, and you can place little aliquots of product along that bony orbit. But the key again, go deep, slightly undercorrect. If you're new at tear troughs, don't overcorrect. So sometimes when I start off with tear troughs on patients, I'll start with just one syringe of a Restylane or Juvéderm and do a half a cc on each side. Some patients really are a full correction, 1 cc per orbital rim, but you want to err on the side of slightly undercorrecting. Don't overcorrect. Don't put a big bolus of product there. And rest assured, if you are utilizing hyaluronic acid, you can always reverse that product if there is a problem or a tindling effect. You see that blue hue with hyaluronidase. That's the enzyme that destroys hyaluronic acid. Again, with the Restylane for the tear troughs, we're going to utilize a blunt tip cannula, and we're going to use a 27 gauge cannula, and we're using a 23 gauge needle to pierce the skin. So we're just going to landmark. I slightly bend up my cannula, and you just want to do a slight landmarking of location. We're going to utilize that product. You can do product just along the tear trough, or nowadays, you know, a lot of patients were carrying that product all the way along to that lateral canthus of the eye because we get orbital hollowness in this area. Because remember, we're addressing the cheek volume loss and the temporal fossa volume loss, so you want to make sure you're addressing that lateral canthus of the eye as well. So we're going to actually just do some landmarking where that product's going to go. You're going to take your needle and you're going to pierce the skin. She's already had topical numbing cream. And then we're going to take that needle out and we're going to thread the cannula in. The cannula feels like kind of like dental floss threading underneath the skin. It feels a little fibrous. You're just going to push that product up. It seems a little scary, but it's not. You can tell the patient they'll feel a little pressure. And you're going deep with that product. You can tint up your cannula and you can feel and see where the tip of that cannula is. And again, you want to keep it along the bony orbits. And then you're going to do a retrograde injection. I'm just fanning that product up. And I'm using my finger as a landmark to where that product is going. I'm right under the pupil. We're just putting 0.5 along that orbital rim. And just going to massage that product right along that bony orbit. And again, with utilization of cannulas, you're not causing a lot of trauma or bruising. You can also do a needle and do little aliquots, little perpendicular injections along the bony orbit as well, but you will have more trauma, more bruising, more swelling. So if you do utilize a cannula, you have less downtime and less swelling and risk of bruising or black eye, potentially with using the cannula instead of a needle. So that's 0.5 of the Restylane, and we're going to go to the other side next.